we can't promise there'll be any at the door. So that is our next event coming up. And I'm going to pass it on now to Stephanie and Leah, and they're going to talk about pre- and post-retirement planning.
Awesome, thank you.
Thank you.
Yeah, hi, thanks for coming, guys.
Yes, thank you.
I'm Stephanie, this is Leah. We work for Bankers Life and Casualty. I've been with the company since 2019. I'm dually licensed, I do insurance, and I also do full financial advisory planning as well. So we really specialize in retirement as a whole, not just one area specifically. And we'll kind of go through all the different parts of retirement that will all kind of intertwine with each other and that can affect the life of your retirement, kind of the different steps. Obviously, a lot of things are really individualized, but we'll just kind of give you a broad overview of kind of our company, what we do to help people. And we do have some cards in the back if you'd like to do like a one-on-one consultation. We come right out to folks, no charge at all. Just kind of review your situation individualized if you ever want a more in-depth review. And there's a bunch of pamphlets and stuff back there. Feel free to grab them and help yourself. And I'll let Leah introduce herself as well.
Yeah, I mean, I don't have all the distinctions that Stephanie has, but I am an insurance agent here at Bankers Life, and I started back in September. So you know, hit the ground running with open enrollment for those of us who are on Medicare. If not, that'll be a fun period of time coming up here soon. So hit the ground running there, and you know, have just had a really great time building my relationships with my clients. That's really my priority, is making sure that I'm putting their I'm worrying about their best interests and putting our best foot forward for the length of their retirement. So yeah, I call on Stephanie a good chunk of the time to just come in and make sure that on the financial side of things that they're taken care of and good to go for the length of their retirement. So
yeah, so I grew up right in York. I lived in Berwick for a while, live over in Lebanon now, but we service all of southern Maine, so we see a lot of different scenarios. So we'll just kind of get going and kind of explain the different areas that we work in. So this is going to be the main screen that we work on. These are the 4 main areas of retirement that really will play a role for everybody. The first area is health expenses. This area is any sort of extended care. This area is final expenses, and then this is retirement income. So we're just going to kind of go in order here and kind of give you some information on of these different parts. So the first area is health expenses. We specifically specialize in Medicare. We broker out to pretty much every company here in Maine, so we're not biased to one company or another, but there's a lot that goes into Medicare, whether you should take it, whether you shouldn't. So a lot of people are still working when they become eligible for Medicare. So a lot of people get really nervous. They get all this stuff in the mail. They see everything on the TV. People are calling them left and right. They don't know who to listen to. So again, we are local. We're a super old school company. We sit right down face to face. We never do phone business. We always are in front of our clients, explaining to them the differences of all of the different plans. And whether or not they should take Medicare. A lot of people get scared into jumping right onto Medicare, even if they do have credible coverage through either an employer or their spouse's employer. A lot of people still work these days until 67 to 70. And a full retirement age is different for everybody depending on what year you're born in, but most folks nowadays that are going to retire are still, are going on to Medicare or eligible, are still working and still have credible coverage. So don't let anybody scare you that you have to take Medicare once you're 65 or you're going to get all these penalties. There is a lot of different situations and scenarios that come into play whether you should take Medicare or not. Specifically, if you are still working as an employee, depending on what your coverage is, you would want to compare that to Medicare, first of all, to see what better option. I could say probably 50-50. 50% of the time staying on your work coverage makes more sense, is more suitable financially and benefits-wise. But a lot of the times Medicare also is a lot more cost-effective and can save you some money. But also, if you are retired and your spouse is still working and you're able to stay on your spouse's insurance, it's kind of the same thing. We compare the benefits for your spouse's coverage compared to your Medicare coverage. And a lot of the times I will say, if your spouse is still working and they are able to add you to their plan, sometimes it's more expensive to have either a family plan or dependent on your plan. A lot of the time, if it's just the employee, it's pretty cheap to be on work insurance. When you start adding a spouse or dependents, that's when it kind of jacks the price way up. So a lot of the times we will compare, okay, well, if your husband or wife stays on their work plan, their premium's going to go down substantially, and then you can take Medicare, and overall it might be cheaper that way. But then again, you do want to always compare benefits, because it's not always apples to apples. Sometimes it's completely different. And so that's another thing that we do, is really dig into all of the different benefits, hospital coverage, specialists, doctors, outpatient, inpatient. All of that really comes into play, not just the monthly premium. So don't let anybody scare you saying you have to take Medicare right away or you're going to get all these penalties. As long as you just go about it the right way, have a professional be able to walk you through the different steps to either take Medicare or defer Medicare, you can bypass any penalties as long as you prove that you had credible coverage and there was no gap in coverage from when you were eligible to take Medicare.
Yeah, and the big thing with that too is that, especially when it comes to Medicare, it is so different person to person, couple to couple. The couples that I meet with, I rarely even put the two of them on the same Medicare plan. What works for one person will be completely different for another. And so that's why we really say sit down with someone just so that they can get all the information and, you're putting your best foot forward and you are making good decisions as far as that's concerned. I think one of the biggest problems with Medicare is all of the misinformation. You hear from your buddy up the road or your girlfriend down the street, whoever it is, and everyone's trying to help, but that word of mouth can be really confusing. So that's why we really just recommend sitting down one-on-one just to kind of go over everything and make sure that it's right for you and your current situation.
Yeah, there's a lot that kind of comes into play. So your health, first of all, your doctors, so you might not have the same doctor as your husband or wife, so that might be a completely different plan just based on the networks in general. Your income has a huge play as to how much you will pay for your Medicare. Your Part B is based off of your tax bracket, whether you file single or jointly. So there's just a lot that comes into play when it comes to picking a plan. Just because one person says, like she was mentioning, this plan's great, well, don't just hop on the bandwagon because your doctors might be completely different, or your health, or your prescriptions. Every plan covers prescriptions very different as well. So kind of digging a little bit deeper into Medicare. So you have there's three major parts of Medicare, just to kind of simplify it for you. You have your Part A, which typically doesn't cost anything monthly, as long as you've worked your 40 quarters and paid into Social Security for 10 years. That is just the hospital coverage. It's the room and board. It's basically renting out the room, the bed, the jello, the TV, the remote. Nothing medical comes into play. That's just renting the hospital room. Then you have your Part B, which for the average American is $185 per month. For this year, changes every year. Some years it goes up, some years it goes down. Same with your Social Security. You know how they all, with the federal government changes that. They change the Part B premiums every year as well. And that is everything that comes into play medically wise. That's every doctor you see, labs, hospital visits, inpatient, outpatient surgeries. That all falls under your Part B of Medicare. The biggest thing you need to understand is that that Part B premium that you're paying only covers 80%. You're on the hook for 20%. And there's a few different ways you can go about paying that, getting coverage for that 20%, which we'll kind of go over as well. And then you have your Part D, which is your drug plan. Those range, most of them don't cost anything. Some of them can cost over $100 per month, depending on what medications you're on. Sometimes it makes more sense to go on a higher premium per month drug plan if it's going to cover your copays for your medications, substantially different than the cheaper plans. Also, what pharmacy you go to has a huge play into them. A lot of companies have preferred pharmacies. So if you go to Hannaford's, it might be drastically different than if you go to Walgreens. So that's another thing. And they change every year. So we sit down with our clients, we plug in all of your medications, how often you fill them, the dosage. It's wild how different some medications, 1 milligram might be different than the other. It's the same medication. One plan, one pharmacy might be completely different. So that is another thing that you want to be checking year to year to make sure that there's no surprises for the upcoming year. And when you do go on to Medicare, you need to make sure that you always have a drug plan, whether it's incorporated in your plan or if it's a standalone drug plan, because that's when you'll hit those penalties. Some people say, well, I'm not on any medications. I'm not going to pay for a drug plan. Okay, but 10 years down the road, if you develop some sort of issue and you need medication, you'll get a penalty for each month that you did not have a drug plan. So you'll want to make sure that you have something in place. Just gotta love the government, right? Just
Even if you're not
at
on.
65, but you don't need medicine until you're 70.
correct.
So they're penalizing you from 70 back because you didn't.
If you didn't have a drug plan. But there's a ton of drug plans that don't cost anything at all now, which is great. So we always put somebody, make sure that you have coverage just in case. And it doesn't matter, you can switch your drug plan as many times as you want year to year. But as long as you had a Part D plan in place, there will be no penalty. So that's where we come into play. Every October 15th to December 9th is when all the new plans for the upcoming year come out. So we sit down with all of our clients and we run all their information through. Even if nothing has changed for you personally, the plans change. So we make sure that one year a prescription might be covered great, and the next year they might take that off of their formulary. So we just do our due diligence to make sure that you're not having any surprises, because you can only make a change to your drug plan in open enrollment in the fall. So you're stuck on that plan for the entire year. So we need to make sure that we're just doing, checking off all our boxes and making sure that that is something that is covered for you guys. Yeah.
I have a question. We have private health insurance too?
Yep.
Through the government. 'Cause we're
Okay. Yep. So they let you keep
so
it.
Because of that, yeah. It comes out of my pension.
Yeah.
But,
Nothing's free, right?
but that has a drug plan, of course.
Okay.
So when I turn 65, if I don't opt for a drug plan and I just keep this coverage,
Yep, as long as
Do I
it's
get covered?
considered credible coverage in the eyes of Medicare, which can mean a lot of different things. So that's another thing we'd want to do is we could sit down and look at your summary of benefits, and we'll be able to tell you right then and there if this would be considered credible coverage or not.
Okay.
And a lot of people, like I said, don't take Medicare right away. Sometimes their employer lets them keep their plan, but things might change. So maybe 5-10 years down the road, things might change with the government. Maybe they start charging you more for that plan, or things are straight. Yeah, so things do change.
When we left the Fed service,
Yep.
the counselor told us you don't have a choice. At 65,
They boot you
have
off.
you have to go on Medicare.
Yep.
And then what we have now becomes your supplemental.
Okay.
Yes.
Is what we were told.
Yeah, so with government employees in general, that whole process looks a little bit different. The way that I understand it, different government agencies will do essentially some sort of, that'll be your supplement plan. So we were talking about different ways that you can cover that 20%. That would jump in and kind of step in like that. Generally speaking, I don't know your specific situation. It would be something I would recommend like taking a look at and sitting down with. But that's typically how that goes.
Yeah, a lot of the times they'll make you take your Part A and B, and then they'll use that as kind of to cover that 20% that the Part B does not cover. But I would want to take a look deeper into the prescription plan just to see if that does cover it credibly, because if, like I said, the premiums go up every year. So sometimes some employers even let you stay on for X amount of years after you retire. And as long as you had the credible coverage that whole time, you are able to then apply for your Part B later on down the road. So say in 5 years you say, this plan's just really not working out great, I'd rather just take Medicare. You are able to do so, but there is specific time frames that you have to apply. So for another example, if you were to stay on your spouse's insurance and then your spouse retires, that would give you a special enrollment to then apply for Medicare any time of the year that they do retire. If your spouse was still working, but the cost of insurance was really starting to become more expensive, you couldn't all of a sudden in July just decide, I don't want to be on his or her insurance anymore, I want to go on Medicare. But you do have the option to take your Part B from January to March 31st every single year if you did not take it when you were eligible at 65. But again, you would have to have whoever administered your health insurance plans fill out a form. Just verifying that you did have that coverage that entire time, which we help people with all the time. Another thing people do is some people take their Part A since it doesn't cost anything, but they don't pay for their Part B because they are still on work insurance or they are still on their spouse's insurance. A lot of people do that. Medicare will then become secondary to their spouse or their employer's coverage. But a big thing about that is if you contribute to an HSA or an FSA, you cannot take Medicare Part A and still contribute. So that's another thing that comes into play.
Can you explain the acronyms?
So health savings accounts, a lot of companies offer health savings accounts where you can defer some of your pay into that, and then you're able to pay for health services for no tax-free, essentially. But if you are still contributing to that, I would not recommend taking your Part A because you are no longer able to contribute to your HSA or FSA at work. Federal flexible savings plan. Yep, so our savings account.
You're still restricted to spending that within that calendar year, right?
Correct. Sometimes you are able to roll that into your own IRA after you leave, but you do have to pay the taxes on that. So the benefit of having a health savings account or a flexible savings account is that you can defer your income and deduct it off of your income taxes as not having made that money. And then when you go to pull the money out, as long as you use it for health expenses, there's no tax liability at all. Whereas if it was your regular 401k or pension or 403b, you will, once you start pulling that money as income, you do have to pay taxes. So there is a lot of different scenarios, but that is a big thing I like to tell people. And taking your Part A is great because it doesn't cost you anything, but if you are contributing, you want to make sure that that's not going to affect that area for you. So yes, for going back to the 20% that you are on the hook for that Medicare does not pay for, there's kind of two major ways that you can go about doing that. There's original Medicare, so you have your Part A, you pay for your Part B, and then you add a supplement insurance. That supplement insurance is offered through private insurance companies, and there is a copay each month for those. They range anywhere from $75 to $300 a month on top of your Part B premium that you're already paying. This plan we kind of call the Cadillac of plans. Original Medicare is awesome. There's no networks, there's no referrals. You can go anywhere that you want that accepts Medicare, and it's more of a full coverage. So you might have a deductible of a couple $100, but after that, there's essentially no out-of-pocket costs. There's a bunch of different plans within that range of numbers I gave you, but it is more of a full coverage. Once you hit that deductible, you could literally be in the hospital for 2-3 months and you'll never see a bill in the mail. You pay more ticket price monthly, but your out-of-pocket costs are very, very low. So I typically tell folks if your health is not great, or if you travel a lot, or you just want freedom of going wherever you want and not having to worry if it's going to be in network, and it's affordable to you for your situation, I typically recommend going with original Medicare with a supplement plan just because there is more freedom and it is more full coverage for that 20%. But again, it does cost a lot more money on top of your Part B premium. The other side of things is Medicare Advantage. These are the things, the marketing you get in the mail every day, see all over the TV, all the phone calls. They offer $0 plans for Medicare Advantage. Well, you still are paying your Part B, so again, nothing's free. And kind of behind the scenes, that Part B premium goes to whatever insurance company on the Medicare Advantage side that you choose. The nice thing about the Medicare Advantage plans is there is no additional premium most of the time. 90% of the plans, you don't have to pay anything additional to your Part B. But it is more of a co-insurance, more as a pay-as-you-go. So there might be co-pays when you see your doctor. If you're in the hospital, that's really the biggest thing, where they'll get you a couple $100 a day to be in the hospital. So if you're in the hospital for a week, you'll see a lot of bills coming in the mail. They can code things and decipher what they will and won't cover as well. Again, there's networks. You have to stay within their network. But really the biggest thing is the insurance company can dictate what they will and won't cover. And I'll give you an example. I had a client who had an MRI on his shoulder last year. Insurance company paid for it. He had a little bit of a copay, no big deal. 2 months go by. His doctor said, I didn't really like the results and we need to do a repeat MRI. Well, Medicare Advantage came back and said, we covered one this calendar year, we're not covering another. So that is a big thing you can run into, is that they kind of have more control over what they will pay and what your cost share is. On the other side of things, on original Medicare with the supplement plans, those are all federally regulated. Every single plan that, I'll give you an example, there's a Plan N, there's a Plan G, there's a high deductible G. Those are all the same no matter what company you're with. it's federally regulated. They have to offer the exact same benefits, and they cannot pick and choose what they will and won't cover. If they say they cover MRIs 100% after your deductible, you can get 15 MRIs, and they cannot come back and say that they won't cover that. So that is another big thing. That's just the difference. But again, the Medicare Advantage plans, there's a ton out there, and they work really well for some people. And they also do offer extra benefits, dental, vision, hearing. Again, you have to stay within network, but they do offer, some of them offer grocery cards or transportation to doctor's appointments. And again, a lot of those are at no additional monthly premium. So a lot of the times people will kind of try out the Medicare Advantage plans if they're pretty healthy when they go on to Medicare. And the state of Maine has a cool little rule where you can test drive Medicare Advantage, the no-cost plans, for the first 36 months or 3 years of being on Medicare. And anytime within that 3 years, if you develop a health condition or something comes up and you're just worried for the future that you might want the full coverage back on original Medicare, you are able to go back to original Medicare anytime within the first 3 years with no medical underwriting, no questions, medical questions, health questions. So say you develop cancer or have some issues, you are able to go back to original Medicare with no questions asked. There are a couple loopholes in that, though. You can't be bouncing around company to company on Medicare Advantage. You have to stay with the same plan. So say you signed up for an Aetna plan when you took Medicare Advantage. You'd have to stay on that Aetna plan. And if you switch, and say you switch to Martin's Point or something, that will then kind of cancel out that guarantee issue to go back to original Medicare. So what we do, a lot of folks that are pretty healthy, they say, I see my doctor 2, maybe 3 times a year. I don't see the point of spending hundreds of dollars a month for my medical insurance if I'm not using it. They'll test drive the free plans. And every fall we'll sit down with our clients, evaluate their health, look at their financial situation, and we'll tell them, okay, the clock's ticking, this is how much more time if you decide you want to go back to original Medicare. So we'll always make sure that we do that due diligence for you as well. And the Medicare Advantage plans do include your drug plan at no additional cost. So that does help as well. So those are kind of the 2 main routes of doing Medicare. But like I said, don't let anybody freak you out about the penalties if you don't sign up right away. As long as you have credible coverage in the eyes of Medicare, you should be all set, and we can explain how to defer your Part B and your Part A, or sign up for your Part A or your Part B. If that is your situation, and you really would want a professional to look and compare the benefits for you, just so that you don't think you have credible coverage and then down the road realize that you don't. So that's kind of Medicare in a nutshell. The biggest gap in Medicare is moving on to this assisted care. Has anybody here ever known anybody that needed to be in a nursing home or have a home health care nurse? So that is one of the biggest gaps in Medicare. Medicare was never intended to be a long-term type of health insurance, which back 30, 40 years ago wasn't that big of a deal. But now people are living a lot longer. Nursing homes are very overcrowded, and the price goes up every single year. The average cost of a nursing home is anywhere from $8,000 to $15,000 a month. And Medicare will pay the first 20 days of being in an assisted skilled nursing facility. You have to jump through a bunch of hoops again to get those 20 days covered. Some of the Advantage and supplement plans will cover you up to 100 days at a cost share, but after 100 days, no matter what Medicare plan that you're on, you're completely on your own. So this is really the biggest gap in Medicare that I like to educate people on and make them understand, kind of paint a picture for them. Because a lot of people don't do the proper planning for this, and that will be the first thing that will cause people to go bankrupt. I'll give you an example. My Pepe, when my grandmother passed away, he moved in with me and my father and my stepmom. And it was fine for the first year or so. He could still get around, but then things kind of started to decline. We lived in like a split level house, so we literally were carrying him up the stairs. My father worked nights, so a lot of people say, oh, my kids will never make me go to a nursing home. Oh, my kids will take care of me. Okay, well, I hope that they would help at least a little bit, but do they have their own families? Are they going to miss their kids' soccer game because they have to bathe you? Like, a lot of people think that it's not really that big of a deal, but it really, really is a huge deal. And like I said, unless you can get state funding, which I'll go through in a minute, you are 100% on your own after that 100 days. So there's a few ways that you can kind of go about this, but really you can either do trust planning or some sort of like long-term coverage. There's a few different ways you can do that to protect your not only your care but also your assets. And I'll give you an example. The state of Maine, for instance, they will step in and give you care, but they will make you go through the state spend down. I'm not sure if anybody's familiar with that, but basically how that works is you have to pay out of pocket and liquidate your basically all of your assets. For a single person, you can keep $10,000 of liquid assets. For a married couple, the person that's applying can keep $10,000, and the person that's not applying can keep $157,920 of liquid assets. But if you're both applying, you can only keep $15,000 of liquid assets. So if you think you have money that you're leaving the grandkids or your house, they'll come after. You can gift away all you want, but the state does a 5-year look back. So if you were gifted your house to your son, and then 3 years later you end up in a nursing home and you aren't able to self-insure, and you need the state to kind of come in and basically give you a Maine care bed to live in, they will come after your children, whether you're still alive or not. Even after you pass away, they will come back after that unless your money is and your assets are in either an irrevocable trust. A revocable trust they can still come after. Irrevocable is the only way to really protect your assets, but again, then you're giving up control of all of your things. Or you can do long-term care planning, which will pay for your nursing care home either in-home or in a facility, and whatever bucket of money that you have, say you have a policy that's $400,000 worth of benefit, you can spend all of that $400,000 worth of benefit. Then the state will come in and give you financial assistance, but they let you preserve however much money you had in that insurance policy. They'll let you keep that in liquid assets for your family. So that's another way to kind of protect your assets, which is kind of complicated, but like I said, everyone's situation is very different. So we're able to kind of sit down and explain how it would affect you individually and your family. If your husband or wife went into a nursing home, you can keep the house as long as the other spouse is still living and one car. But other than that, any liquid assets that you have, you can basically kiss goodbye because you're going to spend them down very quickly. And even if you don't, the state will come and take them after you pass away. So that really, not to scare anybody, but that really is the biggest gap in Medicare, that there is no coverage from the federal government to help with that. So it really is a big eye-opener. And like I said, nobody wants to see their mom or their dad or their spouse in a Maine care facility. I don't know if you've ever been in one, but my Nana passed away in one last year. The staff is amazing. They're all super nice, but they're not the Ritz. I'll tell you that much. It's not somewhere that you want your loved ones to be. You want them to have very good care, and you want to be able to stay home as long as possible. So that's another goal that we try to help people really paint a picture to understand that this can and will probably happen to you. It's a 70% chance that a single person will need some sort of skilled care. For a married couple, there's a 90% chance that one of them will need some sort of extended care. So again, your loved ones can help, but that's a full-time job, and I saw it firsthand, and it got too much after a while, and we ended up having to put my grandfather in a nursing home, which luckily, not luckily, but he passed away right before his money ran out because he would have had to move to a Maine care facility, which nothing against them, they're God sent, but again, you want to have very good care and be as comfortable as you can. Do you have anything to kind of add to that?
No, what I like to really explain, and again, not to scare anyone, but it really is a matter of when, not if. And so having options when that does happen is really important. So doing the planning now, at least you're setting yourself up. You still have the options versus if it happens later down the line, you haven't done the proper planning, there's not a whole lot that you can do to prevent falling into those nasty situations. So a lot of the times I hear, I'm in my 60s. Why is this something I have to think about right now? I'm completely fine. And it's, yes, that's the truth. But if we don't have these tough conversations now, then it's going to look a lot different in the future. So
Yep, so like I said, they do that 5-year look back, so you can do your trust planning once things start going downhill, but they will look back 5 years. You can do long-term care planning, but it's kind of like any other type of insurance. Your house, you don't have your house burning down and you call up Geico and say, I need homeowners insurance. So it's something that you need to plan when you're healthy and when you're able to prevent those issues down the road. So I really just like to make people aware that that is the biggest issue in this country with any sort of long-term care. Life is a lot different than it was back in the day when families lived together, generations, grandparents, kids, families, they all lived under the same roof. It looked a lot different. So this was really never an issue until the past, I would say, 20 years. Everybody's very individual. Women and men both have full-time jobs. It's not like a homemaker situation much anymore. So it just looks a lot different for families now. So that is a big thing. So that is kind of that area that we covered. The next area is final expenses. This is life insurance or final expense insurance. We are licensed with the state. We represent pretty much every carrier out there. And a lot of people that we work with already have life insurance in place, which is great. But the biggest thing that we find or run into is, oh, I've had the policy for 20 years. I'm not touching it. Well, that's great. I'm not ever going to tell anybody to change what they have. But it's really important to review your life insurance every few years. And I'll give you a couple examples. We've had clients pass away, and all their beneficiaries were wrong. And people come out of the woodworks when people pass away, and let me tell you, things get really messy. Very tight families turn against each other, so beneficiaries can be wrong. I've had people's social security numbers be completely wrong. That takes up so much time to get the benefits paid out, especially when people are grieving and don't have $10,000, $15,000 to pay for a funeral. That really can be a big burden on people. Another thing is a lot of old life insurance policies. Again, people were only living till 70, 75 years old. Now we have 85, 90-year-olds with these policies that are blowing up, basically, because the policy's not healthy. Either they're not funding it correctly, or there's a whole bunch of options inside of the policy that they never even knew. A lot of the times, policies, if they're old enough, can even pay for their premiums that people didn't know about. And utilizing the different areas inside of a life insurance policy can actually save you and your beneficiaries money in the long run, because if you have a lot of cash value built up in that and you pass away, well, the beneficiary doesn't get the death benefit and the cash value, they only get the death benefit. So you want to make sure that whatever's built up in that policy is working not only for you but for your loved ones. So again, we can service any policy that's already in force, and we do broker out to a lot of companies as well. Social Security pays a whopping $255 for your funeral expenses, and I don't know if any of you have ever had to deal with planning a funeral, but a simple cremation can be only a couple $1,000s, but that's literally just your ashes in a plastic baggie. Traditional funerals are anywhere from $10,000 to $20,000 when it comes to the plot, to either the casket, the event in itself, or the service. So really having that proper planning in place is important for your beneficiaries. The biggest thing about it is it's tax-free. So if you want to leave money behind and you have money earmarked for your funeral, putting it into life insurance is one of the smartest ways to do that, because it's no taxable event for the beneficiary. They inherit that money and they don't have to report it to the IRS. They don't have to claim it as income. It's all tax-free to them. Another thing is it avoids probate. A lot of people, I say, oh, I have $20,000 in my savings account, so I'm not worried about it. It's sitting there for my funeral. Okay, well, once you pass away, anything that doesn't have a named beneficiary on it goes to probate court, whether you like it or not. There's no way to get around that. And that can take up to 6 months. People, if they owed people money that they didn't even know about from 20 years ago, that it gives people time to basically say, are there any debts owed? So again, that does take a long time. You have to become executor of the estate, go down to the probate court, and it can just be a lot of time and issues, complications, when you really need the money pretty quickly when somebody passes away. So that's kind of what I have to say about that. A lot of people also say, oh, I have accidental death and dismemberment from my local credit union. I'm fine. It's $5 a month for $50,000. Well, I'll give you an example. We've had a client, I think April was telling us a couple of years ago, who got in a car accident. It was a couple. On the death certificate, the female, I believe, got transported to the hospital, and she ended up dying of complications in the hospital. The gentleman died on impact. So on his death certificate, it said accidental, died on impact. For hers, I think they wrote heart attack. So there's no way to get around that. Yes, it was an accident, and then she ended up passing away from that. But unless you die from the accident, it has to say on the death certificate that it was due to an accident. So that can cause a lot of issues. People think that they're covered. There's a reason that those policies are very cheap. And I always say something's better than nothing. So if that's all that you can afford, or that's all that's doable for you, then again, something's better than nothing. But only about, I think, like 2 to 5% of accidental policies actually end up paying out. So a lot of people just don't understand the difference. And it is good to just kind of have, or people say, oh yeah, I have a whole life policy, yep. And we look at it and I'm like, this policy runs out in 2 years. It's a term policy. And a lot of people don't really realize that when they take it out, or they forget because they've had it for 20 years. And then at that point, it is more difficult to get the right amount of coverage. It's more expensive the older you get, or health changes. So it is important to kind of look at anything that you already might have that's in service already. It is good to have a professional review those policies. We are licensed with the state, so we are able to service any policy that's already in force. You can literally call into the company with you, sitting down with you, ask them all the questions, and just make sure that it's working for you in the way that it should.
Yeah, and the big thing for that too is making sure that whatever policy you have or don't have, if you do have a policy, making sure that policy is still fitting your need for it. You're entering into your retirement, whether that be, legacy planning, you want to leave money to your kids in a tax-free way, or you want to just cover burial expenses. There are a few different reasons why you would have life insurance, and just making sure that it's fulfilling the purpose that you've designed it to. And so that's why, those reviews are just really important to make sure that, it is serving its purpose.
Right, yeah, and then from a financial standpoint too, a lot of the times people, when they have young kids, they need a couple $100,000 of coverage if something were to happen to them. They don't want their kids to have to sell the house that they are growing up in. So that makes sense to have a big benefit like that. But sometimes when you get into retirement, it doesn't make sense to pay a huge hefty premium for a huge benefit if the circumstances have changed. And like I said, something's better than nothing. I've never delivered a death benefit check and had somebody be upset with me. So even if it's for $1,000, like I said, anything is better than nothing. And then the last area we'll go into is retirement income. This is really just your nest egg that you need to protect from being a funnel effect into these other areas. I'm a fully licensed financial advisor, so I can kind of explain any different type of plan that you might have or that you might want to look into, and all of your different options. Obviously, when you're in your 20s, your investing is going to look wildly different than when you're in your 60s, 70s, 80s. And we are a full retirement company, so our niche market is really 55 to 85. We do our planning substantially different than a lot of other firms that kind of just put you in a risk tolerance and will invest the same no matter what age you are. So it is good to have somebody that really specializes in retirement because things look a lot different. A lot of the times when you're in your accumulation phase, you just want to accumulate as much as you can. You're still working, you're still making an income, you can take the risks of the stock market. Once you start to get closer to retirement, a switch kind of turns on, or off I should say, and you'd rather kind of preserve what you have rather than trying to chase big gains and be really volatile and risky. So there is a lot of different ways that you can do that. Social Security comes into play huge, obviously, in your retirement income. Social Security is only supposed to supplement 40% of your income. So it's kind of how are you going to replace the rest of your income? When you go into retirement, a big thing that we do is sit down and figure out how much you're really going to need as income, because a lot of it changes. You might not need as much income as you did when you were working, or maybe it's going to be exactly the same. So we need to figure out how you're going to supplement the rest of that income that you were making when you are in retirement. A lot of people have the question, when should I take my Social Security, which is another big question. And again, full retirement age in the eyes of the federal government changes depending on what year you were born in. So people born in 1960, their full retirement age isn't until 67. So a lot of people are still working, and they ask me, should I take my Social Security at 65 because I'm eligible? And that's again, is a very individualized answer. It's not a broad answer for everybody should take it or shouldn't take it. Really depends on what your financial situation looks like. If you are still working, I don't typically recommend taking your Social Security because you can only make a certain amount of money per year. And if you make over that, they will tax your Social Security every $2, $1 of it will be taxed. So a lot of the times it doesn't make sense unless you really need it to meet your monthly budget. Another thing is if you're married, one spouse's benefit is substantially larger than the other spouse's. Well, as long as you're married, the spouse whose benefit is less, if their benefit is less than 50% of the other spouse, they can take, the one spouse can take their full benefit and the other spouse can take 50% of their benefit together. So you're getting basically 1.5 of this of spouse A if that benefit ends up being more than spouse B's full Social Security payment. Also, if the spouse passes away that has a higher Social Security payment, the living spouse can then take their payment that is more than theirs once they pass away. Another situation is people that are married and got divorced. If you were married for 10 years and then you got divorced, you are still able to take the other spouse's Social Security if they pass away or if their 50% is more than yours, as long as you don't get remarried. And it will not affect their Social Security at all, even if that spouse got remarried. If you were married for 10 years and you divorce, as long as you're still single, you can still collect their Social Security. But if you get remarried, then let's hope that spouse makes more than your ex-spouse, right? So that is another thing that will come into play as well. Another thing is a lot of people retire and they have 401ks, pensions, 403bs, and a lot of people keep them in those accounts and they say, why would I move it? What's the point of doing that? Well, there's a lot of reasons that I can tell you as to why you would want to roll that money into your own individual accounts, which we were kind of explaining before. The main reason is you want to have that money in your own name. You want to make sure that you have full control of your assets. And I'll give you an example. If you have a pension and you have the option of taking a lump sum or you have the option of getting payouts, so you can get a payout monthly for your lifetime, but if you were to pass away next year, well, guess what? That money goes to the pension company. Your family doesn't get that money. Sometimes there are survivor benefits. You can take, okay, I will take this payment and I'll take a little bit less of a monthly payment because after I pass away, my husband or wife can get 50%. Well, sometimes that math doesn't really math because you could make those returns by doing it your own way, and then you will still have that bucket of money after you do pass to be able to leave it to the proper people that you want to leave it. It's kind of cutting out the middleman. Another example I'll give you is 401k. So a lot of people, even if you're still working, if you're over the age of 59 and a half, a lot of the times 401k or 403b companies do give you an option of what's called an in-service rollover. So you can roll over as much money or as little money out of that 401 or 403b into your own IRA. It's not a taxable event as long as you do it correctly, which is why you'd work with a professional. And you can still contribute to your 401 or your 403b and get that match. The only free money you'll ever get in the world is a match from your company for a retirement account. So we never recommend cashing it out until you're actually retired from the company. But there are options where you can do rollovers. And after you retire, you want to get that money away from that company and into your own individual name. God forbid something happened to that company, you're the last on the totem pole. I'll give you an example. Tupperware filed Chapter 11 bankruptcy last year. Tupperware is a huge, huge company. And one of the advisors in our branch had a client from there that he had done an in-service rollover. And thankfully he did, because 6 months later when they filed bankruptcy, well, they have to pay all of their debts before they pay you. So I'm not sure if his coworkers ended up getting their full benefit. Sometimes you will, but it could be a blackout period. It could be 10 years from now until they get that benefit because, again, they have to go through all their debts. And a big company like Tupperware, you never think, oh, that'll never happen. Well, it does. It does happen. So really making sure that you're protecting your assets and being able to have the freedom to do what you want with it is another big thing. Another reason would be inside of a 401k or 403b, they really only have to give you very limited options of how you can invest. In your own IRA, you can invest that money however you want, or you don't have to invest it. And a big thing that we do here at Bankers Life is make sure that we have different buckets of money. We never put all of our eggs in one basket. We have safe money that's protected, has no exposure to the market, has a fixed interest rate. And as you know, if you watch the news, the market is going like this, and then it comes up, and then it goes right back down. So we always make sure that our clients are protected and know that the bulk of their assets are in a place where it's not at risk, and we can kind of ride the wave of the market volatility, and we have something to kind of back us up when we allow that other bucket of money to kind of ride the wave of the crazy stock market. So that is a big thing that we do, is just making sure that your individual income, that you don't outlive your money. We can do a full retirement analysis for you and say, okay, if you were to make this much percentage per year, if you draw this much monthly, this is how long your money is going to last. So we can paint a pretty clear picture for you of what is realistic and what is unrealistic in retirement. Another big reason, or another big thing that comes up is working with a financial professional. I don't know if you've ever heard of RMDs, required minimum distributions. Any qualified money is pre-tax money, money that you have not paid taxes on yet. Uncle Sam wants his piece of the pie at some point. They don't want you to just roll it from generation to generation. So they do require you to take a certain percentage. Right now, that age is 73. You have to take a certain percentage, and it's different for each person how much percentage that they need to take out of their retirement accounts per year. It is going up. If you're born in 1960 or later, that number is now age 75, which is a little bit better. But again, just stressing the importance of making sure that you have a financial professional, making sure that you are taking those required minimum distributions, not only now, but when you're 90 and might not even know who your sister is. So we just make sure that you don't have any penalties, that we're following all the tax rules. I'm not a tax accountant by any means, but I do have a lot of education in those ways, and we do work with a lot of great accountants. Another thing is just making sure that you're leaving money in the right way. The worst thing you want to do is leave all this money behind to your family and then put them in a higher tax bracket and be sort of a burden. I mean, you never think leaving money is going to be a burden to your family, but really just making sure that you're leaving it in the correct way. Really is a big thing that we like to stress to people, because a lot of times people say, oh, well, I have all this money. Well, sometimes it makes sense for you to pay the taxes on it when you're older than it would be for you to just leave it to your kids and then have to have them take that tax burden. And there's so many different scenarios, but really just making sure that you're leaving your money behind the right way is very important. So yeah, we have a whole bunch of flyers and stuff back there. Feel free to take. And if we do ever want to do a one-on-one consultation, we have cards back there. You can fill out your information, and we're happy to reach out to you guys. We can sit down and do a more personalized one-on-one consultation at no cost to you. More than happy to do that. And do you have anything kind of else to add?
Not really, just, for those who have entered retirement already, congratulations. Those who are maybe about to, this is an important chapter in your life, so just making sure you've done the planning so that you can enjoy it to its full extent is really great. So
yes, these are really just the 4 areas that are the biggest things that you need to start thinking about now and down the road, and making sure kind of everything's set up and in place for you and for your loved ones. A lot of things too is we don't only work for our clients, we work for they're our extended family. We work for their generation to generation. I can't tell you how many clients I have who's, when they pass away, they don't even have to question. They call me and I help them. It doesn't matter if it's an account that they had with me or not. If they had one piece of business with me, I'm going to sit down and walk them through how to do their whole estate and really help them and be a personal advocate for my client in person and not just a phone call. I will be there in person for them and really just having somebody that they trust. So it is good to know that when things do happen, there's somebody there that's advocating for them and for what they want. Obviously, we're not lawyers, we don't do wills or trusts, but those are other big things that are very important and making sure that they're updated. We work very closely with a lot of estate lawyers that can help. I couldn't tell you how many meetings I've sat in with estate lawyers with my clients just to kind of, you should have your professionals working with each other. You don't want them to not have any idea what they're doing on this side when we're kind of doing something on this side and they intertwine. So I have sat with a lot of my clients with their attorneys, going over their wills, going over their trusts, because if I'm the financial advisor for all these accounts inside a trust, I need to know exactly how that trust is lined out and how things are supposed to be done. Because trust planning is great, but it does make things very complicated. It's supposed to make it easy, but it does make it very complicated for the trustee and the beneficiaries. But just having somebody that's in the loop and really knowing what's going on is important. So like I said, feel free to take any of our information back there. We have our cards. You can give us a call, or anybody that you may know, pre or post-retirement. It's never too late to start thinking about all these different areas. Even if people think they have things all set in stone, I can't tell you how many people I've met with that it's really not. Things that they just haven't really dug very deep into. And we're just always here to be a local advocate for any of these areas or all of them for people, okay? Any questions?
Yes.
Yeah.
RMDs. You mentioned the age where you have to, like, I think for us
Yeah.
it'd be 75.
Yep.
Is that when you start to take it, or you have to already have taken it out of those
You have to
funds?
start. So a lot of
Alright.
people have some retirement accounts that they pull monthly income off of, but some people don't. So they just make sure that each year you're taking a certain amount of your IRA money per year once you hit age 75. You can take it before, but even after, every single year you're required to take a certain percentage of your qualified accounts. Some people that's not an issue because they're pulling monthly income off of them anyways to live off of. But if you have like inherited IRAs and things like that, there are so many rules that come into it. So if somebody leaves their children an IRA, they have to take that within 10 years or they're going to be severely penalized. So that's another thing we do is making sure that the RMDs, or if their parents passed away and they were already collecting their RMDs, well, they have to continue to take those. So there's a lot of different things that go into it. But yes, once you are 75, you have to start taking a certain percentage of your retirement accounts per year, so Uncle Sam gets his piece of the pie. Just so it's basically to pay so you pay your taxes on those.
But if you haven't taken the full distribution out of it, your heir gets it, right? At that point.
Correct. Yep. But they will have to take it within a certain amount of time, and they changed that. So a couple years ago, it was 5 years. They could stretch it out over 5 years. So if they inherited or like an IRA from their parents, they would tell them, okay, you have to take all of this money within 5 years, so that basically you pay your taxes on it. Now they've stretched it out to 10 years, which is awesome because sometimes people are in a completely different financial situation than their parents were, and inheriting even a couple $100,000 can really put them in a different situation, especially if you're getting state health insurance or food benefits that can completely shut it off. So you think sometimes you're leaving money and putting your children or your brothers or nieces and nephews in a good situation, but it's really important to look at those accounts and see who your beneficiaries are, so we can make sure that we do proper planning so that it's left in the correct way.
Okay, so we can give it to an animal rescue instead. Spare the relative.
You could, right? You can leave it to whoever you want. And I always tell them, and they won't know until you pass away. Right, yep. And if your relative calls me up and they're not on there, I say, I don't know who you're talking about. Yeah, right? Go to the ASPCA. I bet there's a bunch of nice equipment in there now, right? But yeah, thank you guys so much for
Yes,
coming
thank
out. And
you.
if you have any
Appreciate you.
questions, feel free to take our information, and you can bounce stuff back and forth, or we are more than happy to sit down with you one-on-one.
Thank you so much.
Okay, you're
Yes, thank
welcome.
you.
Yeah, thank you so
Thank you.
much.
Thank you.